What are some of the myths that are surrounding neurodiverse individuals?
One of the thing is they don't have emotions. Does this mean you can say anything to them, whatever you feel like?
Okay. Also, does it mean that they don't want friends? They like to be left alone. So you don't interact with them because you feel or you assume that they like to be alone?
Do you think they procrastinate a lot? Do you think it is deliberate?
Okay. And do you think that they're arrogant, they're snobbish, they don't want to interact, they don't want to mingle, they don't want to associate themselves with you? What could it be?
Do you think they don't have a family life? They can't have a family life, or
because-
but which family doesn't have problems, and
So-
everyone has to adjust?
Exactly. So are these reality or are these what are the assumptions that we have made?
That is something to ponder upon.
Yes.
Now that we've understood the myths around neurodiverse individuals, what does one do if you identify yourself as a neurodiverse individual, or your sibling or your child in the house?
Imagine if you have any reading or eyesight issues. You go to a eye doctor, you get tested, and based on what you require, you get your glasses prescribed and you do it.
Yes.
Similarly, if you are facing challenges, by going through all this, a lot of you think that you also have somewhere something, some challenges around all these, but not everybody needs input or therapy. Things become a challenge or an issue when they're affecting you in your daily life, in some functioning, in any form of functioning. Like we've discussed, it could be in school, with peers, or workplace. If you're struggling and this is affecting you, you need to go seek professional help. For children, you can go see a pediatrician to get initial guidance, or you can see a pediatric neurologist, pediatric psychiatrist, or a child development physician. For older people, you can see a family physician or a psychiatrist, and they can guide you. Once they see you, talk to you, they will understand what is happening and what assessment needs to be done, and then formulate how we can help you. But one thing, remember, this is not very easy like a blood test. Do it, you get a result, it is black and white. Sometimes we may need time to understand the whole process. Things may overlap. To get a clearer picture, we may need time. So be patient. The therapy is also not a tablet or an injection where you do it and it is solved. It is about evolving over time, developing coping skills. When you're directed to the therapist, go see them, work with them, and then you can actually see good results. It is very important in your children if you start seeing this to start then itself, because at that root level where they're growing, if the base is made strong, resilient with coping skills, as adults they can do much better.
Okay. So we are saying we have to identify the red flags. Yes. And also come away with mental stigma. Don't have the stigma of, we should not ask it because it's a mental health issue. And third, understand that this is an individualized program.
Yes.
Each person is different, so the therapy will be different. And acceptance.
Yeah.
Very important. Like I gave you the example of glasses. Before that was a stigma, now it is not.
Yes.
So
exactly,
let us
yes.
do the same here.
Yes.
We've been speaking a lot about trying to include neurodiverse people. What exactly do you mean by being inclusive?
Okay. Inclusive is for everyone. So it means to embrace all kinds of people. So for me, someone else might be different. They have to be different. So it is not just applicable to neurodiverse per person. It is for everyone. So you're embracing everyone for what they are or who they are. There is no discrimination. There is equal access, equal opportunity given. There is equal treatment. You are treating another person as a human being, accepting them with all their strengths, weakness, everything. Because when we meet a person, we have a certain expectation from the other person. And when that expectation is not met, we label them. So why do you meet someone with an expectation? Be an open mind, accept them as who they are. So at that time, all this labeling will be of no matter. That is what is inclusiveness. To just accept the other person as they are.
And a lot gets reflected in the tone that we speak
Of
with,
course,
the language,
yes.
the words that we use.
A look, one look,
Yeah.
you know, it's just a look, but it carries a ton of message.
Sure. So we have to be sensitive in
Of
our
course,
body
yes.
language around
Yes.
people,
Yes.
the tone that we use, the
Yes.
words that we use.
Yes.
Yeah.
Our intolerance to certain things. So when we manage all that, inclusivity comes automatically. Yes.
Yeah. Let us move to how we can help neurodiverse individuals within our home and our organization and in our teams. What can a family do? What can family members and relatives do to help individuals with neurodiversity within our household?
We have looked into how these people struggle. So creating spaces, they may feel very overwhelmed when too many things are expected for them to do.
Okay.
Sharing what can be done, having a little breaks. If it is getting too much, it is okay, just step out, breathe for a minute, come back and do it. Or if you just want to pace up and down for a minute, it is okay, you will feel more relaxed, you can come back and focus again and go back to the task, rather than sitting in one place wanting to finish it, getting overwhelmed and not doing a good job.
Okay. To add to that, I think they also need opportunities to practice social communication. Whether it is to communicate emotions, whether it is to communicate a difficulty or a problem or a conflict that they are undergoing, whether it is to communicate a request or asking for help. I think they need to have family members encourage these skills within the household, isn't it?
Yeah, and for both of this to happen, there has to be acceptance in the family and the extended circle. Because nothing will happen if there is no acceptance, and the inclusivity that we are talking has to be there. It starts from the family.
Right.
So when that acceptance factor is there, things do fall in place.
So we need to kind of create that atmosphere so they feel okay, they can open up, they can share,
Yeah.
and we can have a time, a family time, which we are losing out. What we used to do before, sit together and eat,
course,
or
yes.
just have a time you go out, just you're being without gadgets also,
Yeah.
and talk about what is happening inside, so the other person understands it is not just you or me, it happens to everyone, and they will find that strength
Of course,
from
yes.
each other.
Yeah.
Similarly, everybody needs to have a self-care rituals,
Yeah.
right? Everybody needs their me time. Everybody needs to have something to help their physical strength, their physical stamina, some ritual or activity to take care of their mental health. So self-care rituals in place for all members within the household, I think, again, will help them to cope with will help each member of the family cope.
And everything starts from the family. The root is the family. So how a child is made to feel at home is what is going to be reflected outside, be it a child or an adult. So how accepting they are at home, how normal, we label normal so much, but none of us are also normal. So how normal they are treated at home is also a matter to be concerned about. So they have to feel that acceptance. Yeah.
So we looked at how at home we are supporting each other. Now moving on to the next step, we are going out, working, peers, employers. How can these people support
Okay.
to be inclusive?
I think one of the first things that co-workers can do is to have distraction-free workspaces. A lot of the conditions that we've spoken earlier require that the space around them to be clutter-free, so that their mind and thoughts get a bit organized, and therefore their work and productivity gets better.
Yes.
moving on, if they are struggling to work in a workspace, give them the option of work from home when possible.
Yeah. Yeah, that makes sense. And also, if an individual is very sensitive to sound, you can have noise cancelling headphones, you know.
Yeah.
So we are stuck with earphones listening to music, and I'm sure they will enjoy it if there's no noise. So we can make that arrangement.
Sure. We also spoke that they are at risk for mental health difficulties.
Yes.
So maybe mental days off, mental health days off to be help them to cope with the stress
Yes.
that they are feeling.
On similar lines, they may not be okay with the certain time schedule patterns. Having a bit more flexibility around when they can log in or log off, when they can come in or off, is a good option.
Yes. Workshops can be conducted where the team members or all the employees can understand what is the latest approval, what has to be done, how can we be a bit more sensitive, what do we do to bridge a gap. So it will be a two-way program. So all people will get together and they will try to, understand what's going on in the other's plate.
Right. So these are some of the accommodations
Yes.
that co-workers can give. But each individual needs to find their own coping mechanism
Of
or
course,
their
yes.
own accommodation within the
Yes.
workspace
Yes.
to help them function smoothly and have better productivity, isn't it?
Yes.
So, individualizing these plans is very important.
Yeah.
So, throughout, you have seen how three different individuals have been sitting together and giving one kind of a program. We have used our strengths together, we have helped each other out to get this outcome here. She is good in planning, organizing. You see her with notes. I come up with ideas. She is very innovative, very creative. That is why we could present this to you. So, let's work together.
Togetherness is strength, and variety is something which is very essential. So when you meet different kinds of people, you learn more about yourself. So why are we not accepting towards that?
With that, we leave you to
Ponder. Yes.
Thank you.